and welcome to Healthy Living. I'm Stacey Young, the Customer Service Director at Western Baptist Hospital, your host today. So excited to have with us Dr. Ben Thompson. He's a board-certified internal medicine physician who practices hospital medicine at Western Baptist. We're so glad to have you today.
Thank you.
Got a pretty serious topic on hand, and that is smoking cessation. Can be kind of an emotionally charged topic, but you know, here we are close to the National Great American Smokeout, and as I was preparing for today's show, there's a statistic that really jumped out at me. More than 450,000 people die in the United States from preventable death due to smoking-related reasons, and we know that includes cardiovascular, stroke, and cancer. So, you know, for years, Dr. Thompson, there's been attention nationally on the dangers of smoking and the health effects. And you hear a lot of talk among smokers, it's just a bad habit, but maybe it's an addiction. Which is it?
I think there's no question that it's an addiction. I mean, when you really break it down to a more simple level, nicotine is a drug. Mm-hmm. And nicotine is an addictive drug which is found in cigarettes. The problem is that when you get the drug nicotine, which a lot of times can have a very addictive quality very quickly for people who smoke, you're also getting a lot of other significant health detriments with that. There are many carcinogens which are in cigarette smoke, and I think there's no question, and I think that there's a multitude of studies that support this, that I think if you say that it's just a habit, that's something that is very premature in the fact that there's a lot of evidence to say that this is a very powerful and a very strong addiction. Mm-hmm. I would also say that anytime if you were to talk to somebody about their endeavor to quit smoking, they would probably tell you it was one of the hardest things that they ever had to do, and would definitely agree that it was an addiction.
Right. So how easy is it to get addicted to smoking?
I think it's something that varies from person to person. I've talked to some patients who say that they began smoking when they were very young, and they seem to think that it didn't take but a few weeks, if not a few months, before they got addicted to the habit of smoking, in addition to the craving, kind of the nicotine that goes along with cigarette smoking. Other people, you know, some people seem to think that it took longer. And I've talked to a lot of patients who have been smoking for shorter periods of time, and they seem to think that they wouldn't have any trouble getting off cigarettes. And so it's tough to know in that situation if someone truly is addicted yet or not. What I would say is anybody who is actively smoking, that in my opinion, the addictive nature of smoking can happen very quickly, very promptly, probably much more quicker than any person could anticipate. So in that setting, the safe play is to put the cigarettes down, never start.
Yeah, good advice. So much discussion out there between the smoke that's inhaled and the health effects on the smoker versus the secondhand smoke. And so can we spend some time talking about the differences and how that plays into health for both parties, the smoker and the person who perhaps is getting that secondhand smoke?
I think that's a very important question. And in fact, I kind of draw upon a patient that I saw recently in the hospital, a patient who, she was a female in very good health, but had actually been living with another person who had smoked for a lifetime. This particular patient had never smoked herself, never picked up a cigarette per her report, and yet she got a diagnosis of lung cancer, which more than likely was caused by the secondhand smoke exposure. A lot of people don't really think that secondhand smoke exposure is a real problem. It's something that I think the public needs to be educated about. And it's something, if you are a smoker, I do believe that every smoker kind of needs to know the health consequences that they have both personally, but also that they can affect on other people who are around your habit. From someone who smokes kind of directly to the smoker, the list of problems that they can have, it's numerous and really profound. The one that I hear a lot of people immediately jump to is they say that, well, if I'm a smoker, what's my risk for cancer? And lung cancer is a thing that immediately a lot of people jump to, and that's certainly a very plausible thing to be concerned about. But there are many other health risks associated with smoking. not only lung cancer, but there are a variety of other cancers, oral cancers, nasal cancers. Pancreatic cancer has been shown to be correlated with smoking, bladder cancer, kidney cancer. People can get chronic obstructive pulmonary disease, COPD, emphysema, chronic bronchitis. Other things that people typically aren't aware of is that there is absolutely a direct correlation with smoking and cardiovascular disease. The #1 cause of mortality in the United States is cardiovascular disease, and there is a direct connection between cardiovascular disease and smoking. It's unmistakable. Along with that, cerebral vascular disease and stroke. Other thing, especially in women, osteoporosis. There are significant health consequences for women who are pregnant and the effects that it can have on the baby. So it's really one of those things that is wide. It has a very broad spectrum about things that it can do both personally and to those who are simply exposed to secondhand smoke exposure. So I think it's important that we do what we can, and I think Western Baptist does a good job of that, of really educating the public about the health consequences of this addiction.
And we think about secondhand smoke and children. Unfortunately, you see kids in cars, windows rolled up, adults smoking. What happens to these kids? Will it hurt them, and how?
For children, the things that I always worry about kind of first and foremost is #1, are you kind of setting an example for them about your personal behavior and something that kids just want to mimic their parents.
Sure.
And so what I worry about is them seeing that as something that they will pursue in the future. I think that certainly increases the likelihood that if you as a parent smoke, the likelihood that your child is going to smoke is going to be much higher. The other things are kind of the problems that can go along with it is secondhand smoke exposure, especially in children, can predispose you to the one that I think of immediately as asthma.
Mm-hmm.
I mean, it is a precipitant for really causing an obstructive lung disease and really triggering that, and can cause some potential respiratory problems even at a very young age for people who are exposed to secondhand smoke exposure.
And for those kids, particularly if you get a diagnosis of asthma, kids are with smokers in the home.
Mm-hmm.
Does that asthma go away if the smoke goes away?
The risk of getting an exacerbation of the asthma should be minimized.
Mm-hmm.
A lot of times, I mean, we have people who come into the hospital that we admit to the hospital. I don't admit children, but I do have young adults who have had a long-standing history of asthma. They say that it started basically when they were a child, and it's very clear that there are certain things that can trigger an asthma exacerbation. Smoke inhalation is one of those.
Yeah. You know, as a physician, you see and treat a lot of smokers. If you had to pick your biggest concern for them, what's the most likely target in terms of a disease or a condition? What do you worry about with your patients?
The two biggest ones that we see more than anything, I would probably say 2 or 3. Number 1, obviously, is cardiovascular disease. Mm-hmm. Again, the number 1 cause of mortality in the United States by far is cardiovascular disease. And again, a direct correlation between smoking and the effects it can have on the heart and really the vascular system. So people who come in with any cardiovascular related problem, I certainly would obviously recommend that they quit smoking, as there's a direct correlation between the two. See a lot of people who have chronic obstructive pulmonary disease who have smoked over a period of time and who have gotten to a point where they require oxygen at home, and eventually it can get to a point where your lung disease gets to a point where the damage is just irreversible, and you can get emphysema, which can be a very debilitating disease, chronic bronchitis, among a variety of other things. And then obviously the biggest one, and the one that, and rightfully so, should scare a lot of people, is the lung cancer. Unfortunately, we do not have any great treatments available to cure lung cancer. It's one of those that when you get the diagnosis of lung cancer is obviously very scary to every patient, and I think there's a lot of research that's currently taking place to try to do things to combat lung cancer, but it still remains at the number 1 mark with regard to mortality among all forms of cancer is lung cancer. So those are the big things that I would worry about.
I want to switch gears a little bit and talk about young people. Again, I was doing a lot of reading on this, and wow, a stunning statistic I came upon was for teenagers, if they have friends who smoke, they are 13 times more likely to smoke themselves. When we talk about young people and smoking, are there additional health concerns there? We're talking about kids who are still growing and developing. What are some of those risks that teens and young people who smoke run into?
You know, the main thing, a lot of people, what I would tell any person who is young and who is considering that they're going to start smoking is that a lot of people think that, well, when I start smoking, I really don't have to worry about the health consequences because those health consequences won't affect me until some point down the line, and then inevitably I'll have quit by then. The patients that I have seen, and in fact many of them who are smokers that I've seen, all tell me that they started smoking when they were very young. And actually their very early teen years, I have a number of patients who even started before their teen years, which is scary.
Wow.
And they tell me one thing in common is that when you start that young and when you get that pattern in your lifestyle, again, going back to the question that you had earlier, the addictive quality of this problem, it makes it extremely difficult to get off of that, especially when you have other peers that you're around who are constantly reinforcing the habit and the addiction that you're a part of. You know, the good news that I would say is that the effects that smoking can have on you, if you quit early enough, some of them can be reversible. So if you do some damage to your lungs, there have actually been studies that have shown, and these are in older patients and adults, but they have shown that if you quit smoking, some lung function can improve. And typically what our pulmonologists do and what we can do in the hospital are tests called spirometry, where you actually measure a patient's lung function. And studies have been done that have actually measured patients who were active smokers and what their lung function was like, and then actually measured them at some point down the line after they quit the habit, and has actually shown that you can actually have improvement in your lung function. What I would stress is that the objective here is to never start the habit in the first place, and that the health consequences are very real, and the addictive quality of this is very real, and the primary goal here needs to be to educate the young people to prevent them from starting in the first place.
Absolutely. And you know, I was thinking about, you talked about those patients that you have in the hospital that started smoking at 13, 14 years old, and you fast forward 50 years or so, and describe their life in terms of their ability to, you know, walk very far, to breathe without oxygen assistance. What kind of quality of life do many of these people have?
For some, it can be dramatic. We see a lot of patients who get admitted to the hospital with what we call chronic obstructive pulmonary disease exacerbations, COPD exacerbations. People who, I mean, what I tell folks is imagine it this way. Imagine never being able to do what you're accustomed to doing without having your oxygen with you. Never being able to get in the car, never being able to go out to a restaurant, never being able to do anything that you would normally be able to do socially, going to a party, going to the movies, wherever, without your oxygen. You know, for some folks, it's just something that through a lifetime of smoking and the damage that they've done to the lungs, the only way that you can keep their oxygen levels in an adequate range because of the disease that they have is with supplemental oxygen. And you know, going back to really kind of mobility issues, some people that I have in the hospital have trouble, you know, getting up to go to the bathroom. Some people can have shortness of breath symptoms even at rest, depending upon what stage of disease that they have. So it's tough for people really to understand unless you, I wish I could take these people along with me to see what I see. And I think that would probably be the best perspective. But I mean, from my perspective, I can see people who can't perform their activities of daily living, which they're accustomed to, because they're always short of breath. And imagine how scary it is when you get short of breath. When any of us get short of breath, what a scary feeling that is. That's something that a lot of these patients feel chronically, and they're tied to the oxygen. And so it's something that obviously is a life-changing disease.
Right. So there is some good news. You can walk away from these things.
Absolutely.
You know, there's people who can just lay down a pack of cigarettes and never go back and just go cold turkey, as they say. But so often those folks don't find true success in long-term and quitting. From a medical standpoint, are there things that doctors can do to assist patients in quitting? What are those?
There are, and there's actually a number of things that you can do. Typically what I tell patients is that, well, number one, what every patient needs to know who smokes. It doesn't matter if you smoke, if you've been smoking for a very short period of time or a very long period of time. Number one is that there is nothing that you can do to benefit yourself from a health perspective more than putting those cigarettes down. The second thing is that I really tell patients that before you're going to quit, every patient has to make a personal decision. It's got to be something where in their mind they have established a date. And typically what I tell my patients is get out a calendar, and on that calendar I want you to circle a date. It doesn't matter to me if that date is a week from now, if it's 6 months from now. But what needs to happen is every patient who is smoking, they need to have a date on the calendar where they say, on this date, my life changes. I'm putting the cigarettes down for good. And then that's where something in that situation where I can get involved in, or a personal physician can get involved in, I really like to target this in kind of 2 or 3 different ways. I think it's very important that people have kind of behavioral modalities, social support systems, education in place, like the Clayton Method, where that they can really have the education, the information about what's going to be happening as I try to get off cigarettes. People who go cold turkey, when they try to put the cigarettes down, they don't realize what symptoms they're going to experience. Your body has acclimated itself to having nicotine on board, and when that nicotine goes away, there are going to be some withdrawal symptoms that many times are unpleasant and uncomfortable. None of which are life-threatening. All can be managed, but you need to know about them ahead of time. So that's one strategy. I like to couple that with medication therapy, which can help and assist. Nicotine is a drug, and so when the nicotine goes away, we can give you nicotine back in a much safer form than smoking cigarettes. Nicotine patches, they have lozenges, they have gum, they even have inhalers that kind of mimic a cigarette. So giving nicotine replacement back to aid in preventing some of those withdrawal symptoms can benefit. And then the last thing are some other medications that can kind of take away the craving to start smoking again. One of them is a relatively newer medicine that's on the market called Chantix. It's a medicine that's been shown to have a lot of success in taking the craving away for people who have been smoking really for a prolonged period of time. Another medicine is called Wellbutrin or bupropion. It was initially actually marketed as an antidepressant, and they found that these people who were on this medication stopped smoking. And so now they market it as Zyban as well. So I think the most important thing is every patient needs to establish a date when their life changes, when they put the cigarettes down, and then you need to target this in 2 different forms of therapy. One is kind of the more behavioral side, educating yourself, getting a good social support structure in place, knowing what symptoms and anticipating those symptoms, and the number 2, medication, nicotine replacement therapy, possibly a medicine like Chantix or Zyban.
What kind of withdrawal symptoms do patients typically experience, and how long do they last?
It can vary from person to person. Typically, I tell all patients that for a few weeks, you're going to have some withdrawal symptoms, and then they're going to dissipate. Initially, what you're going to see when the nicotine goes away, the most common one is people get very irritable. A lot of times I'll have a husband and wife, and one of them has tried to stop smoking, and the other will tell me what a difficult person they are to deal with when they try to put the cigarettes down. So irritability, kind of feeling jittery and nervous and anxious can kind of go along with that. Insomnia, difficulty sleeping is something that's very common when you try to stop smoking. Some people have the sensation that their heart's racing. One that we see very commonly, and honestly this is one of the things that's difficult to combat, is weight gain. A lot of people, they stop smoking and they crave other things. The issue here is that instead of going for a bag of chips or a bag of cookies, need to have good options in place to hopefully prevent the weight gain, which a lot of times causes people to go right back to smoking when they start putting the weight on. But again, this all goes back to really thinking that it's important for patients to be educated about this. When you go cold turkey and are not anticipating any of this, people don't want to give it a chance. When you know what battles you're going to face and what struggles you're going to have to overcome, people do much better.
And using the husband and wife scenario that you mentioned, how much success do you see if both are smokers, one tries to quit, and one doesn't?
Much more difficult. And what you've got to do, and that's why I tell a lot of my patients, is that I think it is very important for you to have a social support system in place. You need to have other people with you who are going to help you in this endeavor. And if you've got somebody with you, whether it be a spouse, even a friend that you're living with, and they're smoking, particularly if they're smoking in your environment, like in your house or in your apartment, it's going to be extremely difficult. If you've got a good social support system in place, and the best thing would be for the person that you're with to put down the cigarettes on the same date. But if not, you need to have some type of remedy where you try to minimize that exposure as much as possible. A lot of times, you know, what I run into is people tell me that, I know it's a very an addictive problem, but going back to the habit question that you mentioned, people just tell me that, you know, I've been doing this for 20 or 30 years and I'm just used to the reflex of smoking. That, you know, when I wake up in the morning, I have a cigarette. When I'm driving in my car, I have a cigarette. When I'm out socially at a particular environment, I have a cigarette. And so training people to understand that you need to prepare yourself, that instead of immediately going for a cigarette, you need to have some other option in mind, whether that be a piece of gum, a hard candy of some kind, a healthy snack, something else to substitute for that cigarette which you've had there for reflexively for a long time.
So the withdrawal symptoms, while intense and uncomfortable for everybody, they will go away.
They will go away.
The weight gain is something to think about, but when you see patients who actually gave them up, who've been successful in quitting, what kind of feedback do you get, you know, when they're sort of on the other side of all of that and they're smoke-free? What do they talk to you about?
Tremendous change in lifestyle. People tell me that the smell that they had on their clothes, the smell that they have on their fingertips, the discoloration that they have on the fingertips from chronic smoke exposure changes. Their sense of taste changes. All of a sudden foods taste much different. There's much more of a quality to the food that they couldn't taste before that they could once the smoke was gone. Their pocketbooks. If you can put down a pack of cigarettes, especially today, given how much a pack of cigarettes cost, and I have some people who, you know, have smoked not only a pack, but some people who smoke 2 or 3 packs of cigarettes a day. The financial impact can be tremendous. And then the health benefits, obviously. People tell me that they breathe better, they don't have this chronic cough that they're accustomed to having, kind of that deep, rattly cough that for some people can be embarrassing socially. Those things will improve over time. They tell me that they can get up and when they exert themselves, when they're trying to do something like exercise, that they can do that much better and with much less effort because of the effect that the cigarettes is no longer having on their body. So there are really a vast variety of changes that every person experiences.
Sure. Now you mentioned Cooper Clayton. That is a stop smoking program that's offered through the Kentucky Cancer Program. Do you refer your patients there, and kind of how does that work?
So this is something, I learned about this a number of years ago. It was actually developed at the University of Kentucky. 2 people at the University of Kentucky where I trained actually developed it. If I remember correctly, one of them was actually a dentist and one of them was actually a PhD who actually specialized in addiction. The dentist was actually a smoker, and so they developed this kind of comprehensive model going back to those behavioral techniques of really seeing if you can get somebody enrolled in a program that's not going to be short term. I think typically they're about 12 weeks long, where you really have a good social support system in place. You educate the patient, you focus on behavioral strategies, you try to really do a multi-dimensional approach to tackling this problem. And I think that's where they have more success, is that some people try to go into this and try to use one particular area of therapy to see if that will benefit them. Cooper Clayton is a program where you try to really incorporate many dimensions in the process of trying to get somebody to put the cigarettes down.
Right, and it's more of a step down.
It is.
Program than just, you know,
Cold
cut
turkey.
it out.
Correct.
Which I guess would help. Does that minimize some of your withdrawal symptoms when you're cutting back on nicotine in a slower pace?
I think it will. I think that you know, the symptoms that we talk about, if you're going from something that your body is acclimated to and cutting that off immediately, the withdrawal symptoms that you're going to experience are going to be more significant. When you're slowly kind of tapering a drug, which nicotine is, and the effects that it has are, when you slowly kind of taper that away, I think you can anticipate that the changes that your body's going to experience are going to be more gradual and be more diminished.
Right, right, good. So, you know, for Cooper Clayton and those interested in that, the Kentucky Cancer Program will take registrations for that ongoing every time they have a class starting. So people can contact the Kentucky Cancer Program to sign up for that, and that number will be up on your screen, so our viewers will have that information. The other thing that I wanted to kind of talk about a little bit more is that whole social aspect, you know, of kind of changing your behaviors socially, because, you know, I see people, they quit smoking, but then they go out to some event, and, you know, you don't want to keep people at home in a closet.
Sure.
What are some, you know, are there the gum you talked about? What are some things that can kind of help people through those hard times?
I think the biggest thing is that if you really want to be successful in doing this, obviously, you know, you don't want to kind of cut off all social ties. You still want to be able to do stuff that you enjoy doing, but I do think you're going to have to make some sacrifices. So instead of going particularly somewhere where you know it's going to be filled with a lot of people who are going to be actively participating in the habit that you're trying to quit, that's going to be a very difficult time for any person who's trying to stop smoking. So I think up front what you really have to do is prepare yourself that you're going to have to make some lifestyle modification. Not to say that you can't do things that you enjoy or things that are fun, but initially up front, when you're really trying to put this habit down, you've got to do things that are going to minimize exposure to those types of situations. Again, going back to kind of what patients tell me is that, you know, reflexively, when I go to a particular place, I'm just accustomed to lighting up a cigarette around my friends. Well, if that's the case, you need to try to minimize that kind of exposure. Try to go somewhere different. Don't go back to that same place where you reflexively, you know, reach for a cigarette. And if you have to go back to that place, you need to have a strategy developed and in place that you can use once you get there. And typically what I tell people is, again, going back to, you know, if it's a stick of gum, if it's a hard candy of some kind, something in place that you can have to go to besides going for the cigarettes.
So there's good news. There are a lot of great physicians in this community and the surrounding area who can help patients get started on that road. So today we've had Dr. Ben Thompson with us. A lot of good information, lots to think about. So we want to thank you for your time and for the education that you've given us on smoking cessation. Until next time, I'm Stacey Young. This is Healthy Living. Thank you for joining us.